So what are sleep disorders? Sleep disorders are conditions that affect or disrupt sleeping patterns or habits. We will specifically be exploring insomnia, narcolepsy, sleep apnea, and night terrors. The first sleep disorder we will explore is insomnia. Insomnia is persistent problems in falling or staying asleep. True insomnia is not the occasional inability to sleep that we experience when anxious or excited. About 10 to 15% of adults suffer from insomnia and often overestimate how long it takes to fall asleep and how long they have slept. There can be quick fixes for insomnia, such as sleeping pills to help relax the body. Narcolepsy means numbness seizure and is caused by an inability of the brain to produce enough hypocretin. It manifests as periodic, overwhelming sleepiness and usually lasts less than 5 minutes. Some narcoleptics fall directly into REM sleep and their bodies go limp. It's rare and only affects about 1 in every 2,000 people. Surprisingly, March babies are 45% more likely to have narcolepsy, and September babies are 37% less likely. This is attributed to the seasons and temperatures that affect babies in their third trimester, which is a critical period. Sleep apnea is a potentially serious sleep disorder in which breathing repeatedly stops and starts. Apnea means with no breath. The disorder mostly happens to people that are overweight, but as the number of obese people increase, the rate of sleep apnea increases too. Researchers show that 1 out of every 20 people suffers from this condition. The sleeping cycle for people that suffer from sleep apnea is complicated. They fall asleep first, but during the sleep they constantly stop breathing and their blood oxygen levels decrease. A couple seconds later, they will suddenly wake up. The whole process can repeat more than 400 times a night, which eventually leaves millions of people tired and irritable during the day, and they usually have higher levels of blood pressure, which makes them have higher chances to get a stroke or heart attack. Nowadays, scientists have developed a mask-like device with an air pump that can keep the airways open to help patients breathe normal. This decreases the effects of narcolepsy, or sleep apnea. Night terrors happen during stage 4 sleep, where you hardly awaken. Night terrors are common in children, and when it occurs, they sit up, walk around, talk incoherently, experience a doubling in breathing rates, and they appear to be terrified. People who suffer from night terrors are also prone to sleepwalking or sleep talking. They often do not remember the dream, but they remember frightening images. Night terrors are not the same as nightmares. Night terrors occur in REM sleep stage 4, also known as deep sleep. They occur about 3 to 4 hours into sleep. Nightmares, on the other hand, happen about 2 hours before waking up and are most often remembered, while night terrors are not. There are a few questions we should address. Sleep disorders have been more common recently. How is that so? Because of medical advances, we are much better at recognizing sleep disorders in patients. Everyday routines of people in the modern era can cause more stress on the body and the mind, which increases the levels of sleep disorders. And also, since the introduction of electricity, people have had difficulty going to sleep as there's more light and it interrupts our natural cycles. Disturbance in sleep is inevitable. How do we lessen the effects of sleep? Well, we cannot overstress ourselves and should consult a doctor to help with sleep problems. As said in the paper slides before, sleeping pills and medication to treat the symptoms will help. Sleep disorders come in many varieties and affect people in very different ways. It is important to recognize sleep disorders so that you can help yourself and others and better recognize the way the world works. Bibliography.